Xalatan Drops, also known as Latanoprost, is used to treat high pressure inside the eye due to glaucoma or other eye diseases. It works by regulating the flow of fluid within the eye, resulting in lower pressure and helping to prevent blindness. It is important to use this medication as prescribed by your doctor and to follow the recommended daily dosage. The optimal timing for taking Xalatan Drops can vary, so it is best to consult with your healthcare provider to determine the most suitable schedule for your individual needs. In order to use Xalatan Drops, wash your hands first. Do not touch the dropper tip or let it touch your eye or any other surface to avoid contamination. If you wear contact lenses, remove them before using this medication and wait at least 15 minutes before putting them back in. To apply the drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Look downward, gently close your eyes, and place one finger at the corner of your eye to apply gentle pressure for 1 to 2 minutes. Use Xalatan Drops once daily in the evening, at the same time each day. Do not use it more often than directed, as it will not work as well. If you use other eye medications, wait at least 5 minutes before applying them, and use eye drops before eye ointments. Remember to use Xalatan Drops regularly to get the most benefit from it, even if you feel well. If you use this medication in both eyes, repeat the process for your other eye. Do not rinse the dropper and replace the cap after each use. Some common side effects of Xalatan Drops may include blurred vision, burning, stinging, itching, redness of the eye, feeling as if something is in the eye, changes in eyelash number/color/length/thickness, eyelid changes/skin darkening, dry eye, lid crusting/discomfort, or increased sensitivity to light. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Over time, this medication may cause brown discoloration of the colored portion of the eye, iris. If you are using Latanoprost in only one eye, only that iris may change color. This color change may be permanent, but the long-term effects are uncertain. Notify your doctor if this occurs and schedule regular eye exams to monitor it. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Tell your doctor right away if you experience any serious side effects, including eye pain, suspected eye infection, unusual redness or swelling of eyes, rapid vision changes, such as loss of vision. A very serious allergic reaction to this drug is rare. However, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, severe itching/swelling, especially of the face/tongue/throat, dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before using Xalatan Drops, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause allergic reactions. Also, make sure to inform your healthcare provider about any other eye problems or medical history you may have, especially if you've had eye surgery or infections in the past. If you experience an eye infection, injury, or have eye surgery while using Xalatan Drops, check with your doctor about whether you should continue using the same bottle or switch to a new one. After applying the drops, your vision may become temporarily blurred or unstable, so it's important to avoid activities like driving or using machinery until your vision has cleared. If you are pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding. When using Xalatan Drops, it's important to be aware of any potential interactions with other medications. It's always a good idea to keep a list of all the products you use and discuss them with your doctor and pharmacist. If you are using any eyelash treatment, such as topically applied Latanoprost, make sure to let your healthcare provider know. And as always, don't start, stop, or change the dosage of any medicines without first consulting your doctor. If someone accidentally swallows Xalatan Drops, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. So, it is important to keep Xalatan drops out of reach of children and pets to prevent accidental ingestion. It's important to remember not to share Xalatan drops with others. When using this medication, it's also important to have regular eye exams and other medical tests. Make sure to keep all appointments with your doctor and healthcare provider. If you have any questions or concerns about the medication, be sure to consult your doctor for more information. If you forget to use a dose, use it as soon as you remember if it is on the same day. If you do not remember until the next day, skip the missed dose. Use your next dose at the regular time. Do not take an extra dose to make up for the missed one. Make sure to follow the storage instructions provided with your specific brand of Xalatan drops. This medication should be kept out of reach of children and pets. Do not dispose of Xalatan drops by flushing them down the toilet or pouring them into a drain unless directed to do so. When the drops are expired or no longer needed, be sure to properly discard them. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.